Welcome, ladies. Thank you for coming into our women's wellness webinars. I'm so happy that you are all able to join us, and I'm so excited to introduce Dr. Daniel. He is a local community chiropractor, functional medicine practitioner, and founder of one of the largest virtual functional medicine practices in the US. Dr. Daniel is passionate about helping people achieve optimal health by looking beyond symptom management and addressing the underlying factors that influence well-being. So rather than relying solely on prescriptions, he focuses on strengthening the body's structural, physiological, and lifestyle foundations to support long-term health and resilience. So at the core of his approach, as you'll hear tonight, is the belief that meaningful progress begins with understanding our unique baselines of our health. Through advanced functional blood chemistry analysis, specialty testing, and evidence-based lifestyle medicine, he helps our patients uncover the root causes of health concerns, including autoimmune conditions, hormonal imbalances, fatigue, inflammation, and metabolic dysfunction. Can't wait to hear about all this. All right. Dr. Daniel also has a particular interest in supporting women through the complex hormonal and immune changes that occur during perimenopause and menopause, which you'll find a lot of my clientele are joining tonight exactly for that. By combining science-based functional medicine with practical, personalized strategies, he empowers our patients to better understand their bodies and take active role in their health journey. And we are honored to have him share his expertise and insights with our community tonight. So welcome, Daniel. Thank you so much for providing this presentation tonight. I can't wait.
Absolutely. Thank you for having me. Um, I think it's important to always start off by stating that the information I'm going to share with you, this is education. Um, there is some medicine within it, but it's not medical advice, right? So we need to make sure that there's a lot of context behind the things that I'm going to be discussing. And so that's always very important for me for anybody out there listening to things that I'm sharing. Um, there's so many questions that you may have, and I'm happy to answer them. But like I said, this is, educational purposes, not medical advice. Happy to answer questions one-on-one if we need to do that. The other thing is that the promise, of this is by the end of it, I really do hope that you understand the connection between hormones, your immune system, and your inflammation. And more importantly, a few things that you can actually do about it, or at least have a better sense of how to get a hold of it. And it is important to take a step back and see that there's multiple things that are connected. A lot of times you'll see, especially in medicine, we're siloed into one area, like it's hormones and that's it. But like I said, it's connected to your immune system, it's connected to inflammation. So there's a lot of other things upstream and downstream that we need to be paying attention to. So that's the goal behind it all. Um, Certainly, women's health is very important to me. I've got two daughters, I've got a wife. Very quickly, early in my career, and we've all heard this on some level, I realized how much of, misrepresentation, lack of knowledge that there is behind women's health. And just, as a society, we haven't done a good job of answering or asking the right questions to come up with the right answers of how we can address certain conditions. And just now we're starting to, get a hold of it, but there's still so much work to be done. And I definitely, I've been called an expert, but I wouldn't claim to be an expert because I know that we as a society just have so much more to learn, right? There's always
Is
room
the
to
car
grow
right
here.
lane?
The title of today's presentation is Autoimmune Issues in Peri and Post-Menopause. However, I hope that you understand that this really does apply throughout our entire lifeline. And we're going to be talking about this. And again, dissecting the hidden links between hormones, the immune system, and inflammation. And then, like I said, what you can do about it. Now, the things that we're going to be covering, number one, why autoimmunity surfaces to begin with, and also why now, right in a particular time of your life, perimenopause, menopause, 40s and 50s, how is that a tipping point? We're going to discuss hormones, immunity, and inflammation, and those are three things, but they're all connected. And part of the problem, I've got some amazing friends, colleagues that are, just conventional doctors. Like I said, they will typically just look at hormones and that's it, or they're going to look at immunity and that's it. But it all comes together. And so it's very important that we're making sure that we're taking a step back and looking at how it all works. We're going to cover how your history can actually predict your transition. And for anybody that hears this, if they're early on in their teens, 20s, 30s, or if they're getting into perimenopause, menopause, again, tracking this information, the sooner the better, because you're able to predict how well you're going to transition into these phases of our life. Like I said, we're going to talk about a few things that you can actually do. I'm going to break it down into what I call buffer, clear, and calm. These are different interventions that you're going to be able to incorporate to try to help with some of these things. And then finally, there are some important tidbits of information that I think is that we all should know on how to properly partner with our providers. It's so sad. I hear this all the time, where people go to their doctor, they don't get the right lab work done, or their doctor's not listening to them. They have all these symptoms. Of course, we all hear like you feel all these symptoms, but they tell you you're normal, right? Everything looks normal. A lot of times it's because the right testing wasn't done. And so I hope to kind of, shed some light on that and just give you an idea of some of the things to think about when it comes to that. Let's go ahead and get into it. Just a couple of facts, statistics that I think are important. First of all, with autoimmunity, 80% of people living with an autoimmune condition are women. So, obviously there's a big swing in the tide here, right? It's not fair, that men don't experience this as much. And there's, like I said, a big gap in terms of the research needed in order to understand why. Some of the most recent research turns out that, and again, this is not 100% confirmed, but there's pretty good research that shows the X chromosomes playing a big role in enhancing immune factors that go on to cause all sorts of problems. And so, that's one piece of it. Of course, there's also societal demands. There's a difference in terms of the trajectory of how a woman lives her life versus how a man lives their life. And this all leads to what I like to call cumulative load, which we're going to get into. But that's a big number either way. And, with 80% of people living with an autoimmune condition being women, there's a lot of women out there that'll have a lot of symptoms, but as you're going to learn, they're almost gaslit where it's not autoimmunity or they're not properly assessed. A lot of times because the doctor doesn't know what to look for. And so, it's again important to kind of understand this statistic and how big it really is. Now, a couple of other things that the data shows, like I said, 80% of autoimmune diagnoses occur in women. This is another important one. 45 to 55 is the age where the peak age where rheumatoid arthritis onset happens in women. So pretty interesting. And obviously that also connects with perimenopause, menopause. For lupus, it's 40 to 49. Again, the same thing, perimenopausal windows occurring around this time. And like I said, we're going to talk about some of the reasons why, like some of the mechanisms that are actually driving this. I think it's, important to note that there are actual mechanisms that cause these problems. It's not autoimmunity just doesn't happen, right? Just because. The same with hormones becoming imbalanced. They don't just decide to become imbalanced. There's a driving factor. And the job of a practitioner is to identify that root cause. It takes a lot of work, right? And so the most important question we can always ask is why? Why is this happening? And you keep asking that until you figure it out. 17.5% of women have Hashimoto's compared to 6% in men. And this is a big one. Hashimoto's, when we talk about hormones, you have your thyroid, you have your adrenal system, and then you have your sex hormones. All three of those, again, connected. And the most common cause of thyroid problems, autoimmunity and nutritional deficits. And so I want to share this because so often a woman will come to me with a number of different symptoms. She's had all these tests. She swears her thyroid has been checked. Turns out she has Hashimoto's. It was just never properly assessed. And that's a big one. And there's a lot of women out there that don't realize that that's what's actually happening. Now, these are all onset peaks and associations. It's not saying that, it's not a cause, right? So these are just connections that have been made within the literature. Like I said at the start of this, there's just so much gaps. There's so much missing information that we have. And hopefully, over the next few years, we keep moving in the right direction to figure all this out. Now, why does autoimmunity surface during this period of time of transition, perimenopause, menopause? I like to talk about thresholds quite a bit, and this applies to everybody at every stage of life. We all have a certain amount of resilience or capacity. One way to look at this is like you've got a bucket, right? We all have a bucket, and throughout our life, we're filling that bucket up with different stressors. As you can see here on the chart, some we're born obviously with our genetics, and we now know that a lot of that, of course, that's passed on through our parents. That's one piece. Now, that doesn't make you a victim. There's a whole lot you can do to overcome that, and we're going to talk about that. But that's part of what goes into your bucket. And again, you start off with that, right? Along the way, throughout childhood, throughout your entire life, there's a number of toxins, infections. You have immune barrier issues such as leaky gut, which is one of the most common. There's blood sugar disturbance, stress and sleep issues. So you have all of these that are accumulating into your bucket. And then comes along perimenopause or menopause. And again, there's driving mechanisms it's like pouring a lot into that bucket all at once and it just tips you over. So that is the current leading understanding of why. And again, we're going to dive a little bit deeper into this here in a little bit as to specifically what's happening there. But the take home message from this slide is that autoimmunity rarely comes from one cause. People want a root cause, but it's more root causes that you need to be thinking about. And sometimes somebody's on the right trajectory of figuring things out. Maybe they figured out food, but again, that's just one cause, right? There could be other things that we still need to work on that are going to help us to ultimately heal. Also understand that this burden is something that accumulates over a lifetime. And so, I think it's very important to note that it's not something that you do. From a mechanical standpoint, let's talk about back pain for a little bit. It's very common for somebody to come to me and they bent over to pick up their wallet or to pick up their purse and they threw their back out. Well, bending over was the tipping point, right? But that didn't cause their back issues. Their back issues have actually been accumulating over years, and that's just what tipped them over. And so that's something to think about again whenever we're talking about perimenopause and menopause, where when you get into this state, it's just tipping you over. It's a big enough stressor where it starts to then contribute to what's happening with autoimmunity. Cumulative load, this is a good graph just to kind of get a visual. What we're looking at here on the bottom is timeline. So you'll see birth, childhood, puberty, reproductive years, perimenopause, menopause, right, as we go throughout our life. And then there's two different trajectories here. The purple is basically the burden that we're accumulating over time. Again, when you're born with your genes, you're born with your microbiome from mom and dad, so that's kind of set in stone. And then as we go through our life, there's an accumulation, whether that's, there's different procedures, exposure to different environments as a child, antibiotics, of course, different medications. You hit puberty, and of course, that's a transition of where your hormones start to ramp up. You then have all the time in between of your diet, your emotional and physical stressors. Of course, we live in an ocean of toxicity these days, and that's an added burden to all of this. You get into pregnancy, which is itself a stressor. So basically, that burden is just accumulating, and along the way, our resilience is also coming down. Our ability to handle those stressors. What I mean by resilience is like you could come and push me, and if I have good balance, resilience, I'm not going to fall. If you were to push my grandmother, who she just turned 100, great for her. But if you push her, she's going to fall over. She doesn't have very good resilience. We each can work on improving our resilience. And so, a lot of this you can accumulate burden, but you could also be improving your resilience. Or you could do the opposite where you're not paying attention and it's diminishing. And so you can see how the combinations of this, it's different for everybody, but there's going to be a tipping point that can happen at different parts of our life. And so that's, again, what we need to understand here is that when we hit the reproductive years, there's a huge hormone change that can happen through pregnancy. And then the same is happening with perimenopause and menopause. Now, the autoimmune triad, there are three things that have to happen, three things that line up in order for autoimmunity to really develop. One of them you can't change. That's genetics, like I said, right? So it is what it is. However, the other two you have a lot of control over. So you'll see here in the middle where it says a trigger, and anything that is a trigger to our body, just think of that as an inflammatory trigger. Anything that is noxious to our body that our body doesn't like, that's what we can categorize as triggers. Now, you can further break triggers down into big groups. There's dietary triggers, there's lifestyle triggers, there's chemical triggers, and then infectious triggers. And this is very important because, again, it's different for everybody. For diet, let's say dietary triggers, the most common triggers for autoimmunity are going to be corn, soy, gluten, and dairy. Now, that doesn't mean that gluten is bad for everybody. It doesn't mean that corn's bad for everybody. These just happen to be the most common. And so if you have autoimmunity or if you're experiencing symptoms of inflammation, I would ask that you just avoid those for a period of time and see how you feel. Again, corn, soy, gluten, dairy, those are the most common food or dietary triggers. Lifestyle triggers would be things like your bedtime, not going to bed or waking up at the same times, like kind of, having that shift. Our body likes repetition. Some of the best thing you can do for your body in terms of lifestyle is going to bed and waking up at the same time. Exercise, is lifestyle. Not too much, but, not too little. There's alcohol, drug usage, which is part of lifestyle. Again, these are triggers that affects everybody differently. You also have chemical triggers, and this is a big one, especially today. More than ever, we are all exposed to a number of chemicals. The EPA puts out reports. There's a lot of independent research agencies that put out reports on toxicity. And it's well understood today that most Americans, most people living in the United States, we are at our threshold of what we should be exposed to in terms of chemical exposure. Now, going back to genetics for a bit, some people genetically do better with or can handle their chemical load better. Some people do not. And there's ways to figure that out, but just know that that is a big part of what could be driving, these triggers of inflammation in the body. And then finally, you have infections, and these would be infections that you accumulate, of course, over, your entire life. There's a number of infections that can range between viruses, bacteria, parasites, fungal infections. It is possible to get an infection. You get over that infection, but you have a certain amount that stays present. So it's like a smoldering fire over time. And these are known as latent or stealth infections. And so you may not be overtly sick. You may not be, you may not have fever, you may not have stomach cramping or anything like that that you would associate with a typical illness, but this low grade infection is actually affecting your immune system, contributing to issues. So those are triggers. And again, there's a lot that you can do to overcome that. And then we have barriers. Now, most people have heard about leaky gut, right? That's an immune barrier. Leaky gut, just think of it as, you've got your mouth, it's connected to this long tube that then comes down the other way, right? Where you bottom out. That tube is actually protecting you from the outside world. So you eat food, and that tube has to determine whether that food can be processed and allowed for those things to pass into your body. If you have leaky gut, that barrier is disrupted and that stuff just passes through and your immune system goes on red alert, and that can cause a number of reactions. Inflammation, there's skin issues, certainly irritability, brain fog. There's a number of things that can happen from it. Now, food allergies and food sensitivities, that's a hot topic for a lot of people. This is important to understand with barriers. A lot of times somebody could have leaky gut and they will develop food allergies or food sensitivities, but they're not real allergies or sensitivities. They're just symptoms of that leaky gut. And if you repair that leaky gut, those symptoms of those food intolerances go away. And I think that's important for people to hear because there's so many people that are on these depleted diets, very minimal diets, because they eat foods and they run into a number of issues. And that's just not a way to live, right? So some of the biggest wins that I've seen clinically is whenever we're able to repair that and somebody can start eating the foods that they used to enjoy, right? That they can go back to that. So just know that, that's something that needs to be looked into. Now, leaky gut, like I said, is the most common barrier, but there's other barriers we need to know about. There's leaky brain, just like you have leaky gut, you can have leaky brain. So your blood-brain barrier, that can also get broken up and you can have issues. There's leaky skin. So acne, psoriasis would be an example. You can also have leaky lungs, respiratory issues. So people that have allergies, asthma, chronic respiratory problems, that's leaky lungs. And then you can also have your nose, throat, and mucous membranes. So just problems with your eyes, nose and throat issues. Again, leaky nose, right? So these are all different barriers that you can have issues with that ultimately can contribute to the autoimmune triad. So those are the three things that ultimately are what are driving autoimmunity. And for anybody that's wanting to overcome autoimmunity, these are the things that you'd have to investigate to determine for you specifically, what are the areas that need to be worked on? And I go through all that because a lot of times, let's just talk about what typically happens. Somebody has autoimmunity, they're going to send you to a rheumatologist or maybe an endocrinologist, and they'll pretty much just put you on an immune suppressant, right? They're going to suppress your immune system to shut down the immune response, and that's it. That can help with your symptoms, and that's great, but that's not going to work on the root causes, right? So hopefully you understand that. That's the main point of that slide there. Now, this is an important one. Again, you hear so often why people can go to a doctor, they can have a number of symptoms, their hair is falling out, they can't think straight anymore, they can't carry a conversation, their memory is declining, they're losing muscle mass, they can't digest food very well. Any number of symptoms, right? They can be present. You go to the doctor, doctor does assessments and it comes back to where everything's fine, right? They can't find anything. It's a very common situation that you'll hear. And this slide is, the goal here is to help you to understand why that happens. Of course, your doctors care about you and they want to help you. A lot of times they're just ill-equipped. They don't understand the right tests, or the testing that you did get done was accurate, but the antibodies didn't show up. And the reason why is because there's stages to this. The first stage is silent, meaning that if you get the right testing done, it may come back negative and you may not even have symptoms, but the process is happening. It is very difficult to identify whether somebody's in that first stage of autoimmunity, which is the silent stage. Usually this is just going to come back to the collection of symptoms, but like I said, you could already have problems and no symptoms yet, right? What usually ends up happening if you've got a really good doctor, somebody that's evaluating you properly, you're going to find it in the reactive stage, which is the second stage of autoimmunity. And this is basically when antibodies can start to show up, or antibodies may not be present, but you have symptoms. So it's one or the other. And it's looking at both of those, right? Doing enough testing to determine whether or not there's a signal. I'm going to share this. A lot of times somebody will get testing for autoimmunity once a year, or maybe you go to the doctor, you have a number of symptoms, you get tested. That one test is not enough to rule out autoimmunity because antibodies will be present one week and then, a few weeks later they can decline and then they're going to go up again and then they're going to go down. So if you're having symptoms and you were told like everything looks good, don't settle for that one test. That was just a single data point. you've got to make sure that you're testing a couple of times. And the gold standard is actually 3 times within the year. And I'm only saying this for people that know in their heart that there's something that's going on, but they haven't received a diagnosis yet. Even though you've had testing once, I would not settle for just that single test because you could be in that reactive stage and it could get missed. This is, again, a lot of times where antibodies can be negative, but you've got the symptoms, or vice versa. Antibodies are present, but you don't have any symptoms. And the sooner you know about this, the sooner you can, of course, work on correcting it. The vast majority of people, though, at least in a conventional medical setting, are going to be diagnosed whenever you actually have disease present. And this brings up conventional lab testing ranges. Most of the ranges that you get from your traditional labs, those reference ranges are based on national averages. And unfortunately, most people, in the country are not healthy. So if they're comparing you to that average, first of all, that's not good. There's better ranges to use than those standard reference ranges. The other thing is that, again, most of the time, it's not until you see enough damage to where a marker lights up, and then that's when you're going to get the diagnosis when the whole time you could have picked up on that before, right? So you don't want to wait for your labs to finally be bad enough to where you get that diagnosis. The whole idea is to try to figure these things out ahead of time, and just know that that is possible. You just have to make sure you're getting tested frequently enough, and then getting the right types of tests, for this. Now, let's talk a little bit about perimenopause, menopause, and how this actually, works with autoimmunity specifically. Now, first of all, with perimenopause, menopause, there's this big misunderstanding. A lot of times people are told that, your hormones are just kind of slowly decaying and they're just dropping, right? Estrogen is going down, progesterone is going down. And that's just not true. It's not a deficiency of hormone. It's actually fluctuations of hormones. In perimenopause, estrogen doesn't just go down, it's erratic. So it's coming up and it's going down, spiking and crashing. Imagine if we're all in a bus, and I floor the gas pedal and we're going really fast, and then I step on the brake really quickly, and then I step on the gas again and then step on the brake. And if I keep doing that, none of you are going to be happy, right? You're going to get irritated, you're going to get inflamed. That's pretty much what happens when you have these fluctuations of estrogen. When it's erratic, it's going high and it's going low. And why does this happen? Well, what starts to happen during perimenopause, menopause is, we're done, right? First of all, it's not a disease, right? It's not a condition. It's a passage. We're supposed to go through it, but the ovaries basically, stop. They start to diminish in function. And there's a hormone called FSH, follicle stimulating hormone. It's one of the most important hormones to look at if you suspect perimenopause or menopause. You'll start to see that hormone start to go up really high. And again, that pretty much indicates that we're, in this phase of our life. Now, as FSH goes up, it's stimulating follicles, right? Follicle stimulating hormone. And there's a lot of chemistry that's involved here, but the end result is that you get these big swings of estrogen, and then there's a drop off. And that high and low, that actually affects our immune system in a negative way. Our immune system likes things to be balanced. It doesn't like, really big highs and big lows. This is another very important thing to note is that every cell of your immune system, there's a lot of different cells that make up our immune system. Things like T cells and B cells, white blood cells, neutrophils, you have all these different cells. They all have receptors for hormone, especially estrogen. Estrogen is an immune modulating hormone. Now, when you're flooding the gates with a lot of estrogen and then you're taking it away, the immune system detects that as an error. And so then that primes your immune system and you start to get these immune spikes. And this leads into more inflammation. If you combine that with, let's say, some of the other things we talked about, like leaky gut, or maybe you haven't identified dietary triggers, you start to put all these things together, it creates the perfect storm for errors to happen in your immune system. And that's what autoimmunity is. It's an error. It's where our immune system cannot detect itself and starts to attack because of this erratic, play on what's happening. So that's, the important thing to understand as to why autoimmunity tends to happen around this time. Also, before that, there's three big periods within a woman's life where you can see autoimmune occur. The first is going to be puberty when you start to menstruate because of what's happening with this system. And so a lot of times, somebody's going to get diagnosed early on if they're in a good place with autoimmunity. And then, of course, you can do your best to get that under control. The next big window is actually pregnancy. It's one of the leading primary triggers of autoimmunity. And again, this is because of the big imbalances that are happening with hormones at that time. And then finally, you have the perimenopause, menopause window. So these are kind of the three big places, where that occurs. Again, context matters, right? Not everyone lives the same life. Not everybody has the same cumulative exposure to all these things. Some people they figured out their diet. Some people have better lifestyle factors. Some people, unfortunately, have been exposed to bugs that they're not aware of. And so all of these differences are the reason why you can see within a woman's life why some women they have a soft landing during these times, of their life. Whereas you have others where they just feel like they're going crazy. And again, it's not their fault. It's because there's a lot of these systems that are imbalanced and nobody's connecting the dots. We tend to just look, like I said, at one single factor. Now, that leads into this slide, and one of the biggest buffers to perimenopause, menopause is going to be your adrenal system. So let's talk about this for a little bit. When you hit perimenopause, like we're talking about, there's erratic behavior in hormones, right? So your estrogen's going up and it's declining. Um, that huge up and down creates the problem, right? Well, what happens is in that state, and I'm just going to say in a normal quote normal environment where a woman has everything working for her, her adrenals are healthy, her diet's good, she's physically fit, everything's good, right? The adrenals make hormones as well. And when the ovaries start to decrease in function, the adrenals will step in and they can buffer what's happening. They basically can act as what bioidentical hormone replacement would be doing for you. Now, if you're a woman that is depleted, right? And this is very common, by the way. I would say it's probably the majority. Chronic stress, poor sleep, you're just running on empty, basically. You're depleted, and that means your adrenals are depleted. Well, then that means your adrenals can't step in for you. And so that's how it should naturally occur, right? Like I said, perimenopause, menopause is a normal process. Obviously, it makes sense that our body would have come up with mechanisms to protect, right? That's your protection mechanism. But we don't live in a normal environment anymore, unfortunately. We have a lot of stressors these days. And so therefore you have this environment where a woman can go through her life and it's crash landing as opposed to somebody who has a strong buffer. And so knowing this heading into this phase would be very important for somebody, right? To know so that way they can get a handle on their adrenals, measure their cortisol rhythms, and really look to see how is that system functioning, because that's going to help to predict the effects of what perimenopause, menopause would have on you. So again, your adrenal system, very, very important to look at. That's a big buffering system. Hormone replacement therapy, the reason why that works for perimenopause, menopause is because that's what that does. If you have these high and low moments, when you're taking hormone consistently, it acts as a buffer. So it's kind of filling in the gaps. I like to focus on fundamentals and foundations first. And so, if somebody comes to me and they're not on hormone replacement, you bet we're going to work on all these other buckets, on all these other systems first, before resorting to something like bioidentical hormones. Not that that's a bad thing. There are, caveats there, but just because we want to fill in the gaps, below all the upstream and downstream factors. Now, like I mentioned earlier, your history predicts the transition. So, your whole life, right? For women at least, your periods have been writing you a letter every month, right? For up to 30 years. I always like to talk about how your period is a vital sign, extremely important, right? It's like everything that all the data points that you can collect on it. That is the days of bleed, the flow, when you're ovulating, the entire cycle, and is that consistent month in, month out? And if none of you have heard this, there's actually pretty fascinating research coming out on how there's cycles within cycles. So you have like your monthly cycle. Every 3 months is actually another cycle. And then I'm willing to bet that as we start to accumulate more data, you're going to see that this also plays a part seasonally. And we're talking about like fall, winter, spring, that type of thing. And it makes sense because our ancestors lived very much in tune with the environment, right? It dictated our life. And in such a short amount of time, we have taken ourselves out of that environment and we now live, I like to say like we're living in a zoo, right? This is our zoo. And anytime you take an animal out of their natural environment and put them in a zoo, do they get healthier or do they get sick? Every single time you can look at this. This is a big problem with animals in captivity. They get sick, and that's pretty much us, right? And I'm not saying you need to go out in the wild, right, to live, but we need to figure out how to adapt successfully, and that's where the work is how can we figure out how to adapt? And this is very unique and different for everybody. But just understand that your period for your entire life has been sending you messages. And if you're still menstruating or if you're early and you're hearing this, like again, if you're into your 20s or your 30s, knowing what's happening, like if you have bad PMS or PMDD, that is a window into what your biology is doing. It could indicate that you're inflammation prone. There's maybe some genetics there. Or again, there could be some infections that are driving inflammation that are contributing to that. There could be food, factors that are driving that. There's women that have heavy periods. A lot of times, and this is not 100%, but I'm just sharing you ideas of how you connect the dots here. Heavy periods usually mean high estrogen. Now, high estrogen, there's a lot to unpack with that. You could have normal estrogen, but your progesterone is really low. So therefore, it seems like you have high estrogen, right? So that's a phenotype of estrogen dominance. You could also have normal estrogen, but your detox pathways are not functional or not working as well. So you're not clearing that estrogen. Therefore, it accumulates. And again, that could be high estrogen. So when we say estrogen dominance, don't just translate that to, oh, high estrogen. You still have to figure out like what exactly is happening there in order to get the right intervention, right, of how to correct that. Painful periods. That tends to be inflammation load. That would suggest that you have high inflammatory load. And again, the question is why? What's driving inflammation in the body? Is it food? Is it a broken barrier? Your gut, your brain barrier, skin problems, respiratory problems. Are there hidden infections, that we're not aware of? Is there chemical load or chemical intolerances that we're not aware of? And then you have irregular cycles. So irregular cycles would be, if it's like 28 days, which is the stereotypical timeline, right, period, but 28 days, 1 month, and then the next it's 22, and then it's 32, right? So it's kind of erratic going back and forth. By the way, just so you know this, another little nugget, it's now starting to be observed that, and this is why I said there's cycles within cycles. Every 3 months, you might see a change where you could be on point, 28, 1 month, 29 the next month, 28 again, and then it'll shift. The third month, it might be 30 or 31. That's not a problem, especially if you see that there's a pattern there where it stays consistent over 2 to 3 months. And so just know that there's early research that's coming out that's starting to demonstrate that. But the point here is, though, is that you can look at your history, how your periods played out, and that is a good indicator of what could be happening as far as predicting the transition going into perimenopause, menopause. Now, what are some things that we can do, right? Once we're there, if we're in perimenopause, menopause, or earlier, and you have autoimmunity, what are some general guidelines? Like I said, I'd love to be able to tell everybody that listens to this is exactly what you need to do, but that's just impossible because you have to uncover, what's happening, right? You have to investigate to figure out what is your body doing? What's the function of your body? But I like to break this down into 3 categories: buffer, clear, and calm. These are things that we can do to try to help our body to overcome the transition, but also just autoimmunity in general. There's nothing you can do about your ovaries going down, right? It is what it is. That's going to happen. Again, it's just like there's nothing you can do when menstruation starts. It's going to happen. but there's a lot you can do to buffer the swings. There's a lot you can do to build resilience and to also empty your bucket with the stressors that are filling it up. Clearing hormones better, which has to do with detoxification. And by the way, there's multiple detox pathways. It's not just your liver. There's your gut that plays a role. A lot of people have become familiar with MTHFR mutations. Uh, that's methylation. That's a detox pathway. So there's multiple pathways there, but this is very important. Detoxification is how our body cleanses itself. And you detox anyway, whether you do a detox program or not, right? It's just about making that system more efficient. Now, let's talk about the first category here, buffer. Like I mentioned, going into perimenopause, menopause, or if you have autoimmunity in general, you definitely want to evaluate your adrenals. You want to make sure that that system is functioning as well as it can, and if it's not, put together a plan to work on correcting it, because that is your natural hormone buffer. When your hormones start to drop, your adrenals are going to step in. Think of them like your power generator, right? If your hormones, your ovaries are the power grid, if the power grid starts to flicker, then your generator is going to kick in to support. Now, if you haven't been maintaining your power generator, well, you're going to run into problems, right? So that's how you would look at that. So you want your power generator to be efficient and working well. Another buffer is phytoestrogens. And I do want to talk about this as well. Phytoestrogens are just estrogen mimicking molecules. Food is medicine, right? Cruciferous vegetables have a lot of phytoestrogens. Flax has a lot of phytoestrogens. Soy has phytoestrogens. So, these are foods you can consume that can act as a buffer or a shock absorber. Now, how does that work? Estrogen is very potent. Okay, when you have a lot of estrogen in your body, well, again, because it's erratic, right? You have these huge upticks, it'll flood all your receptors on your cells. Phytoestrogens compete against estrogen. Now, phytoestrogens are not as strong as estrogen. Okay, they're weaker. So if you're having these erratic ups and downs and estrogen is causing this, you can flood the gates with phytoestrogens. And so, therefore, estrogen can't bind, and that's what allows for that buffer to happen. And so, that's why it's great to work on increasing those cruciferous vegetables, like I said, flax and soy, at that time of your life. And then there's progesterone. A lot of times, I'm just going to say this, progesterone's pretty safe. I wouldn't have anyone just start, taking progesterone without any kind of analysis, right? Without any kind of measurement of what your body's doing. But I'm going to say it's relatively safe, right? Out of all the hormones, taking progesterone, it's a softener. It helps to calm things down. It helps to improve sleep. And so right off the bat, that's a buffer that you can look at doing. There's also natural uh, progesterone compounds that you can look at taking to help support what's happening there. Now, the clearing phase is about detoxification. Like I said, making sure that all your filters are clear and open and you're able to eliminate estrogen. This brings up an important point with bioidentical hormone replacement. Again, there's a lot of positives, but there's also some negatives. Right now, there's a lot of, I'm going to say, noise online, or you'll hear out there where, there's a big push for everybody to get on hormone replacement. I'm not a fan of absolutes. So I'm never going to say like, yeah, everybody gets hormone, it's going to be great. There's doctors out there that claim that, and that's just not true. There's my own patients, many women that get on hormone, they feel great. However, they're not detoxifying and clearing that hormone appropriately, and it's contributing to problems that are going to eventually grow. And so, you can be taking hormone, feel great, but have problems developing. So it's important to make sure, again, that all these systems are working the way they need to be before you just get on something. Detoxification is a big part of that. And again, you could be on hormone and feel great and not have healthy detox pathways right that are open. This means supporting your liver, supporting your digestive system, making sure that your microbiome is healthy. And there are ways in order to evaluate your microbiome. There's specific tests that you can get done that let you know if you're efficient at clearing hormones through your gut. There's also your kidneys, right? That's a big part. And then sweat. I think we don't sweat enough these days, and sweat is a big detox pathway, that we should be working on. Another important area to focus on is blood sugar. If there was one system, if I walked into a room full of 1,000 patients, 1,000 people, and they all had conditions of, whether it's cognitive issues, brain problems, hormone problems, gut problems, autoimmunity, you name it, whatever condition we could talk about, whatever chronic health condition, if you can get your blood sugar steady and optimal, and there's a lot to unpack with that, but if you can get that in its right place, everything downstream is automatically going to improve. That is how important your blood sugar regulation is, and it's especially important for hormone regulation. And then again, especially important because of that for the transition of perimenopause and menopause. So stabilizing blood sugar and your insulin are a big one. And it also does contribute to some of your clearing pathways, detoxification. You'll see on the bottom here, lower xenoestrogen load. Xenoestrogens are basically just, think of that as chemical load or chemical exposure. It's shocking how many chemicals we expose ourselves to daily, some of us intentionally. Right? If you look at the numbers of like the number of compounds that women put on their bodies before the day even starts, right? And I'm talking about like your shampoos, your deodorants, the cosmetic products. There's a lot there. And unfortunately, these companies are allowed to sell these products individually and they look at safety individually, but not at the accumulation of that. There's almost no studies that are looking at the combinations of these things and how they play a role in our body. Even though mechanistically, even though we do know that the combination of these chemicals is negative, right? But there's just no big major studies that have been done because there's no money in it, right? There's nobody that's going to fund those studies, and these companies certainly don't want to spend the money to do that. But just know that lowering your chemical load, your xenoestrogen load, plastics, by now I think everybody knows we should be reducing our plastic exposure, chemical exposure, right? That's a big one for that. Third on the list here, you'll see calm. And by the way, you'll see that these are things that are foundational. This is easy medicine, nothing fancy. There's so much to be said about working on the foundations and improving those foundations, and everything above that is going to be better. There's a lot of fancy things out there that people can do, a lot of protocols, a lot of things, supplements that people want to take. They're only as good as your foundation. And that's a piece that a lot of people miss, is that they're skipping over jumping to shiny objects, not working, on the foundations. Omega-3 fatty acids are a huge foundation, especially if we're talking about immune function, inflammation, autoimmunity. Omega-3s, they produce compounds within the body that help to basically chew up or break down inflammation. And so that's critical. This is an easy test. You can get an omega-3 index score. I'll just share this with you. The vast majority, easily 9 times out of 10, when I do this blood test on a patient, they're low, they're deficient. And yes, I have a lot of patients that come to me that are already doing healthy things. They eat a lot of fish, they're supplementing with essential fatty acids, their omega-3s, but they're still deficient. The number that you want your blood test to show, your percentage of omega-3s, that should be 8 to 16. In my practice, and again, there's a lot of healthy patients that I have. In my practice, the average is 3. It's like 3.2. So most people come in and they're really, really low. And so working on correcting that again is a huge foundation. Everything downstream is just like working on blood sugar. Everything downstream is going to be better for it. Of course, adopting an anti-inflammatory diet, that's very important. Working on improving your gut barrier. Now, I would argue all the barriers are important, but leaky gut is one of the most common. And that plays a role with driving inflammation. For a lot of you, when we get into perimenopause, they call it, basically brain fog, right? Or menopause brain. You can start to see problems like memory, fatigue. You'll start to see body energy starts to drop. This is really inflammation. Most of the research right now, a lot of the leading research that points to this, it's an inflammatory issue. And there's blood markers that are very basic that you can get done to measure your inflammation. a lot of times those basic blood markers aren't going to show positive. You have to dig deeper and look at some of the more comprehensive inflammatory markers in order for this to show up. But I'm telling you right now, if you're, a woman and you're transitioning, if you're in perimenopause, menopause right now, and you have a lot of brain fog, if you're having trouble with memory recall, I would investigate inflammation. Another important marker on top of omega-3s, there's a marker called homocysteine. It's an inflammatory marker. It also plays a role with B vitamins. That's another big one. So many people are deficient in Bs, even patients that supplement with it, because you're just not taking the right dosage. I could have a patient that, let's say, takes 200 milligrams of a certain supplement, and their levels are perfectly optimal. I could have their twin, right? The opposite of just their twin, who takes the same amount, but it's not enough for their body because their physical demands are different. So just know that dosage is something that you have to work on. So many people take supplements and then they'll say, oh, it's not working. It's not that it's not working, it's you're likely not taking the right dosage. That's a big one. And once you figure that out, once you figure out the right dosage, again, you start to see a lot of these things work for you. But homocysteine is a big measurement for you. If you see that your homocysteine is high and you have brain fog, those are intimately connected. And supporting detox pathways, supporting B vitamins is a way to work on reducing that. So that's very important. And then you'll see down here magnesium, which is another calming. There's over 300 enzymes that are influenced by magnesium. Again, this is a big one. Most people are deficient whenever I measure them. If you ever get a blood test for magnesium, ask for something called magnesium RBC. That is a red blood cell magnesium study, very different from serum magnesium. Most people get serum magnesium, that can come back normal. That tells you what's in your blood, but not what's inside your cells. So again, that's just an example of how things can get missed, right? We're looking at the wrong things, or the doctor did well, but maybe didn't understand that there's a difference between, those two markers. I mentioned B vitamins, B12. You can measure B12, but homocysteine is actually a better indicator of deficiency. There's another marker called MMA that is a better indicator of deficiency than actually measuring B12 by itself. So hopefully what you're getting there is that, there's more to the story than just like doing standard labs, right? You have to get the right stuff done if you really want to dig deep and look into these things. Now, like I said, foundations first. And I think in this order, it's very important. Blood sugar, that's always at the top of the list. We live in a time where CGMs, continuous glucose monitors, those are, it's easy to access those and get them. Hellolingo.com. If you visit that site, you can get a sensor for $49. It'll track 2 weeks of continuous blood sugar monitoring. So it's just a little sensor the size of a quarter. You attach it to your arm, and it'll be able to show you what your blood sugar is doing 24/7. What I like to do is have a patient do that and then don't change anything, live your life, and let's see what kind of data we get. You might find that blood sugar is always high. You might find that you're dipping down low. There's a lot of information you can get from it, and then you start to make changes in your diet and your lifestyle in order to correct course for that. But blood sugar is a big one, and that's something that you definitely want to start with. Number two, this is a big one, and it's so abstract. And I don't want you to think when I talk about stress, I can tell a patient like we need to work on your stress. That should not translate to do more yoga or do more meditation. That's important, right? It's extremely important. There's no supplements you can take to, you can't out supplement your stress. That's important to understand as well. Stress is a real physiological prescription. There are, there's very specific things that you can and should do in order to get your stress under control. Like I said, deep breathing is great. Meditation is great. Yoga is great. All these things are great. But we're all so different. And the way that our bodies receive stress, physically, emotionally, spiritually, energetically, it's all different, I guarantee you. And so what works for one person may not work for the other, but understand that this is not something to gloss over. If you know that you're at your limit, right, in terms of stress, like we all know, like if you just know that you're just so easy to tip over, that's your call, right? You need to start working on that because that's a big one. There's no way that you can correct any of these other chronic health issues if your stress systems are not in place. Sleep, we all hear about that. Of course, sleep, I'm going to say, is our default mode. Um, Hormones, absolutely. I have so many men that work with me, and starting with me, they have low testosterone. But I can tell, there's ways to tell whether their testicles are working and they shouldn't have low testosterone. So that means that they shouldn't be replacing, right, with hormone yet. Sleep is the number one thing to correct on optimizing that. In my practice, my observation, sleep is number one, again, for hormone regulation. And, I realize that there's a lot of people that have problems with sleep. And so it's like you run into this vicious cycle, right, where I'm telling you, like, hey, you need to work on your sleep. And you're like, well, I just keep waking up at 2 a.m. in the morning and I have no control over that. So I get that, right? I hear you and I understand that there's people that have sleep issues, but that needs to be worked on. There's a mechanism that's driving that. One of the most common is going to be blood sugar and adrenals, just so you know, for sleep. If you're waking up at 2, 3 in the morning all the time, that's usually what it is. Again, in my practice and in my observation, that's what it is. Of course, there's racing thoughts, but a lot of times it's the cortisol surge that happens in the middle of the night that wakes you up, and that's why your heart rate is up, or maybe your temperature regulation. If you're wearing a continuous glucose monitor, right, those blood sugar monitors, you're able to see when you're sleeping if your blood sugar is dropping. That's a very common thing where blood sugar drops in the middle of the night, and then that's what causes us to wake up. And once you get that cortisol surge, you're pretty much just going to stay awake for the rest of the night. And so, again, those are just examples of things that need to be teased out or looked into. But that's a foundation, is working on your sleep. And then another very important foundation for hormones is your gut health. There's something called the estrobolome, which is basically the amount of bacteria that live in your gut that contribute to estrogen production as well as detoxification. And so if you have gut issues, you can have hormone problems, but it's stemming from a gut issue. And so just keep that in mind, right? A lot of times women can get told, oh, your hormones look normal. There's so much to unpack with that. But I mean, okay, fine. Let's just assume those hormones are normal, but it could be a gut issue, right? That's driving the symptoms of hormone imbalance. So that's something to understand there. One last thing about hormones. If you get tested, similar to antibodies, if you get tested, know that that's just a single data point. When I'm working, especially with women, if we're going to look at hormones, if she's still menstruating, I'm gonna do a blood test day 3 to 5 of her period. I'm gonna do a blood test during ovulation, and then mid to late luteal. So we're capturing hormones over the course of the cycle to get data and see what's happening rather than just a single blood draw. And that's important because I can't tell you how many times women have been told, "Hey, your hormones look good." They went and they gave blood that morning and hormones look good. I guarantee you, if you send them back that afternoon, the number on that hormone test is going to be completely different. And that's because hormones are constantly going up and down throughout the day. So these are things that need to be tracked over time, not just, a single data point. So hopefully that makes sense, but very, very important takeaway there. Now, what are some ways that you can partner with your provider? I've been talking about some of these things that you should ask for like certain types of blood tests and all that. Um, the biggest and most important thing that I would urge you to push on your doctor is that you get a measurement, you get your baseline, see where you are, and you measure it again, right? Some people, it's like they do an annual exam like once a year. First of all, our blood absolutely changes over the course of the year. Okay, if you're looking at your blood in January, you honestly can't compare your results until the following January. Until you do a complete cycle, that's really apples to apples. If you do it in January, I guarantee you there's going to be some difference that happens 3 months later, difference that happens 3 months from that. But I would think about blood very much like tracking the weather, where the more data points you have, the better you're able to understand your story. You're able to understand what your body's doing and you can make sense of it. You could also, along the way, start making changes, right? You can change one thing, retest, see what the impact is, right? And so that's how you start to accumulate data. And I'm saying this because a lot of times doctors, they're just going to see you for that annual exam and that's it. Or you're going to go with your symptoms, they're going to do your blood test, here's what you got, and that's it. You actually should do a couple of data points in order to figure that out. And that's how you actually solve, the problem of missing antibodies or missing what your hormones might actually be doing. So test beyond the standard panels. A lot of times somebody will have symptoms of thyroid issues and they'll share with me that they're, oh, I got tested, my doctor tested my thyroid, it's normal. And it turns out their thyroid panel was far from complete. A lot of times doctors are very basic with their labs. So you should push for a thyroid panel, the minimum would be TSH, free T3, free T4, and then your thyroid antibodies and reverse T3. That's the minimum that I would have somebody do in order to fully understand, what their thyroid is doing, whether they have healthy thyroid or not. If you're just going off TSH, you're going to miss it. TSH is basically the brain sending a signal telling your thyroid to produce hormone. It doesn't tell you anything whether, it doesn't tell you if your thyroid's actually producing hormone. That's what your T4 is. And then you have to convert T4 to usable hormone, right? So it's not the end of the story. You need all these markers in order to know what's actually going on. And the thyroid plays a big role with what's happening in perimenopause, menopause because of how it influences your hormones altogether. HSCRP is a basic inflammation marker. Hopefully, most people listening to this, if they've ever had inflammation measured, that's an inflammation marker they should have. Make sure it's HSCRP, not just CRP. There is a big difference there. But there's a lot of other inflammatory markers. I mentioned a couple of them. Homocysteine is one. Another one would be fibrinogen. There's something called TNF alpha. There's interleukin. So there's a lot of inflammation markers. And again, if you have painful periods and you had a blood test and you were told inflammation looks good, I would urge the doctor to actually dig deeper and look into those other markers because there's something that's being missed. Blood sugar, glucose and A1C are very common. Ask for insulin. Again, you need to really measure fully what's happening there. And then, like I said, consider a continuous glucose monitor. Measure your vitamin D. That's a big one. B12, folate, homocysteine, like I said, these are also nutrient markers. And then iron, absolutely very important. A lot of times doctors, they'll just base your iron status on what's called a CBC or a red blood cell count. And that's not enough, quite honestly. So I would at least ask for ferritin, which is your iron stores. You could have normal iron, but if ferritin is very low or high, there's some things there that you want to dig into. Like I said, one draw is just a snapshot. It's not enough. And so definitely, again, if you're somebody on this, watching this, and you've been told that, your labs are normal, but you've got symptoms, I would ask for more snapshots in order to dig deeper there. Finally, a very important thing, which I kind of touched on at the beginning of this, is functional ranges are very different from conventional ranges. There's, again, the conventional ranges, which are comparing you to the average person in the US, and then there's optimal ranges. And those optimal ranges are actually different for men and women, and then also based on age. And so just know that is that there's, when we talk about functional medicine or functional health, that's the point. We're trying to assess your function on you specifically, right? Not comparing you to a general population. And so just keep that in mind is that when you're digging deep into these things, that's really where you want to look. When I talk about baselines, measure your baseline, see where you are, and then you put together the foundational steps to improve your baseline. And then you just continue doing that over and over. And there's just so many iterations where you're going to figure it out. You're eventually going to figure out your body's owner's manual. What makes your body tick, right? What are your deficiencies? What are the systems you need to work on? And ultimately, that's how we get better. That's how we improve function. And that's how all of this works together. That's the last slide there. I know that's a lot of information. I was trying to cram it in. I think we're like at an hour. Yeah, happy to answer any questions if you've got them.
So, Daniel, Astarte was asking, how about taking melatonin or L-theanine to help with sleep?
So those are good. So we talk about sleep. Um, so GABA is a neurotransmitter that helps to support sleep, right? And so a lot of the compounds that we're taking are really trying to ultimately boost GABA, G-A-B-A. Melatonin, again, melatonin's a hormone. right? And so I don't like people just to take hormone without having any kind of investigation. If you're gonna, if for anybody out there that's listening to this, if you're gonna take melatonin, I would ask that you start on a very low dose, like zero point 0.5, and you can find products out there where they are low dose, so zero point 0.5. I've even seen 0.25. So start low, give yourself a few days on the low dose, and then you slowly build up. If you have to take three, like 3 milligrams, if you have to start to get up into the higher range, then my alarms start to go off and I want to know why. Like what's missing? Like what's going on there? What is the reason your body is in a deficit that you need so much melatonin? That's the kind of better thing, right? So remember that, supplements, they're great, but they could also just be treating a symptom, and ultimately we want to get to root causes. And so, in the same fashion, and I feel the same way with bioidentical hormone replacement. Again, there's a lot of positives from it, but a lot of times it's just treating the symptom and you're still missing a lot of things underneath the buckets there. That's why I like to start off by correcting the systems, optimizing as much as we can, and then we stack on top of that. But yes, melatonin, start low dose, L-theanine, GABA, these are compounds that you can do as well. I would consider L-theanine to be the safer between the two.
Amazing. Thank you so much, Daniel. That was a lot of information, and I'm sure it's brought up a lot of questions for people. Um, you can reach Dr. Daniel at his email down there, and we're also going to host this on our YouTube if people want to rewatch this or ask any questions. Is there anybody that has any immediate questions for Dr. Daniel? You can unmute yourself and go ahead and speak if you do. You
If
answered everybody's questions.
Yeah, also if anybody wants any references, if anybody wants, kind of a summary or even these slides, you can email me or just let me know and I'd be happy to pass it over, just to get you the information that you need.
Awesome.
Just wanted
Well,
to put something out there real quick in
yeah,
regard to that blood glucose monitor he mentioned on Hello Lingo. They actually have a deal on Amazon right now because it's Prime Days, and I just ordered one myself.
Good job. Yeah.
thank
So
you, Jasmine.
that's great. Thank you for sharing that. Hello Lingo. And then there's another one called Stello. Just so you know, there's two different companies, but those would be the two, big ones. I like Hello Lingo. But
Awesome.
yeah.
Well, and like I had mentioned before, um, we have a question here from Lynn. What book on bone health do you like to read?
Oh gosh, I'm a nerd. Like if you ask me that, like I'm gonna go to textbooks. Like there's, physiological textbooks that I reference and that I look at. Is there one on for bone? So for there's I'd have to look at this. Can't think of the name right now. I know there is uh, a really good book written on, it's not just bone health though, but it actually has to do with perimenopause, menopause. I can't think of the name right now. I'm sorry. Um, I'll share that once I remember it, that I'll share it. Maybe you can send that out, blast it out. I wish
Yeah.
I could come up with a name. If it comes while we're talking, I'll share that. Mark Hyman actually about 4 years ago did a webinar on, you can find it, it's public, just search Mark Hyman and osteoporosis. He did a good job of explaining a lot of the mechanisms that I think are often missed. Like we all should know, I think by now is like, your 20s and 30s are the ideal time to prep your body, right? For what's going to happen during menopause when you start to have these hormone surges and it affects your bones. And so starting early on, but dietary factors like, yes, calcium is important, but if you're not driving that calcium into the bones, if you're not strength training, if you're not building your resilience in that aspect, that it's not going to work as well. Protein, and when I say protein, I'm not saying just eat meat, but meats or plants. I don't care what it is, just get enough protein.
Yeah.
That is huge for bone building.
Yeah, in one of our we've got a one of our topics in the women's wellness webinar is going to be nutrition and
Great.
content, eating for your age. So we'll definitely get into that a little bit more. I think Astarte had a question about gut health, she said.
Yes, I have a question about gut health. I think I missed it. Did you say anything about probiotics?
Good question. Good question. I didn't. So when probiotics, I've been doing this for 20 years, right? And I'm going to just share, like early on, it's like, yes, everybody gets a probiotic. They're so great. They're so important. Turns out that wasn't good advice, early on. Definitely there's a time and a place. Think of your microbiome, right? So the important question is which probiotics, right? Which species, because there's a lot of different species of probiotics. You can get 4 different bottles, by the way, of probiotics at the store, and they can all have different labels, but they're the same species. That's what I mean, right? So you gotta see what you're taking. So that's question number one is what probiotic are we talking about? Number two would be the follow-up to that would be, well, how many good bacteria and bad bacteria do you have in your gut? If you take a probiotic, but you already have plenty of that particular species, you could actually be driving overgrowth, which is not good. When we talk about the microbiome, you want balance. You don't want too many bacteria. You don't want a deficiency. And so it's possible to overdo it with probiotics. That's what I'm trying to get at there. Certainly, if you have a deficiency, right? If you don't have enough good bacteria and you know specifically which ones, you can target that, and that can make a huge difference in terms of how your body's functioning. The other thing you would of course ask, why? Like, why are you deficient in those particular organisms, and what do you do to correct it? So, that's my take on probiotics. They're beneficial, they can help, there's a time and a place, but I don't just have somebody's having gut issues. I wouldn't just say like, oh, go take this. Because, that's just not the truth of it. You've got to dig and find out what's going on there. But they do play a major role. I mean, there's so much. We are more, if you haven't heard this, we are more bacterial. Like we have more bacterial cells in our gut than we do human cells, which is just wild,
Yeah.
right? And these bacterial cells, they have genetics and they express proteins that go on and do all sorts of wonderful things for our body, right? So it's like this symbiotic relationship where these organisms are in our gut. They're producing all these wonderful things that go in and help our body to function well. And so extremely important, right? When we're talking about the gut and the communication between your gut and your brain and how everything works there. But again, I'm not just like go supplement with a probiotic, right away.
Well, thank you very much, Daniel, for all of your information. I will remind everybody that the beauty about Daniel's practice is that he has built a online practice where you don't have to be anywhere near him to go see him. And
No, yeah,
so he does have
Hi.
some hours in Westlake, but a lot of his practice is now through telehealth. And so people can reach out to him and see him regardless of where in the city you live. So that's amazing. So,
I had a question.
yeah, Nikki.
Hey, thank
Mickey.
you. I was just wondering, so on food sensitivities, um, and you're talking about getting tested multiple times and looking at that, and having multiple data points. What about food sensitivities? If like if you have a lot of inflammation or something going on, obviously that could impact it. So like how often do you tell people to get tested if they're having
Good question.
problems?
So let's start with you have food allergies and you have food sensitivities. I always like to just say, right, those are two different things, two different arms of the immune system. Then, if we dissect food sensitivities, you have true food sensitivities, meaning for whatever reason, your body just doesn't like that food. And every time you consume it, it's having an immune response. It's reacting negatively. And there are mechanisms that have been established for that, which is a different topic. But just know that there's true food sensitivities, and then there's food sensitivities that are symptoms of gut problems, specifically leaky gut or barrier issues. And so when somebody comes to me, if they have food sensitivities, you then begin the process of trying to buffer the system. So we'll start with blood, trying to reduce inflammation as much as possible, trying to support your immune cells as much as possible. If anybody out there is going to do food sensitivity testing, know that there's some checkpoints that you should do for yourself. Like you shouldn't just go get a food sensitivity test done because it may not be accurate. If your white blood cells aren't balanced, if you have a lot of inflammation, there's actually blood testing called IgA, IgG, and IgM. You get that tested, those need to be balanced. All those are check marks. You get all those check marked, then you do your food sensitivity testing and it's accurate. I get anxiety thinking about this last week in the world, how many people got food sensitivity testing, and it's like you can't even rely on those results because they didn't go through the proper channel, right, of getting that done. And unfortunately, there's a lot of practitioners out there that just don't know that, when that's established. And so you have to first make sure that you're in the right place to get the right test, right? That's important. Now, if you have food sensitivities again, and it's related to the gut, obviously you got to work on correcting gut issues, leaky gut. And even then, we talk about leaky gut. Everybody here's probably heard about it. There's 3 different types of leaky gut. And so, which one do you've got? There's one, unfortunately, and I don't like to, again, I'm not a fan of absolutes, and I don't like to say never, but there's a form of leaky gut where it's like complete damage, and it's very hard to go back from that. And I think it's important to know, right, if you're in that state, so that way you're not just, whack-a-mole, keep trying to go down some kind of pathway and figure something out. But yeah, you would look at leaky gut, correct that, and then assess those food sensitivities to see if that changes, right? So that's one way to look at that. But I wouldn't have you continuously do food sensitivity testing. That is different from blood testing, right? What I was talking about earlier is getting multiple snapshots of your blood, which is your biochemistry. I like to say blood, guts, and hormones. Like that's the kind of order of priority. You get your blood in check. There's a lot there's a lot of homework to get done on things you can do to improve your blood. If you're still not right, move on to your digestive system. That's the next layer. There's a lot to work on there. And then your hormones, right? I wouldn't just go straight to hormones because there's a lot underneath that could be influencing it. I wouldn't go straight to the gut because, again, there's a lot in your blood that could be influencing it, including food sensitivity testing. Now, let's just say you're somebody that's corrected your gut issues. You've confirmed that things are better from that standpoint. And then we talk about food sensitivity. Technically, over time, and there's a lot of biological clocks that have been established now. There's a term called inflammaging, which is the older we get, it's an immune system response where there's more inflammation. And so your food sensitivity tests 10 years ago are going to be completely different from what they are today. That's all I'm saying there. And it's about a decade. It's about 10 years. So if you're looking at doing repeat food sensitivity tests, I think it would be worth it to look at it like that. I wouldn't, do a food sensitivity test right now and then 3 months later do another one. In other words, does that answer your question, Nikki?
Yes. Thank you.
All right. Well, I think in the respect of everybody's time, since we're already over a bit, if you guys have any other questions, you've got Dr. Daniel's information, and we'll all send you guys an email with the link for the recording. And also, if you have any other questions, you can also reach out to Dr. Daniel. Thank you so much for your
All
time
right.
tonight.
Good night, everybody. Good night.
Good night.